Welcome to another episode of the Your Longevity Blueprint podcast. Today, my guest is Dr. Aaron Hartman, who's coming on the show for a second time. His journey with functional medicine started when he and his wife adopted their first daughter from foster care. She has cerebral palsy and countless dietary issues. They went from specialist to specialist, and even as a physician, he felt let down and confused. His daughter's health struggles forced him to confront an uncomfortable realization. Our current healthcare system doesn't have all the answers. His wife, however, refused to give up hope. She ultimately pointed him to functional medicine, and his daughter and two other children began to thrive. After years in family practice, he felt called to make a dramatic shift. He now helps patients identify leverage points in key areas of their lifestyle and health that harness their body's remarkable power to heal and begin living the vibrant life they deserve. He has become the go-to doctor for difficult and hard cases in Central Virginia. Dr. Hartman's new book, UnCurable, From Hopeless Diagnosis to Defying All Odds, chronicles his personal and professional journey, focusing on his daughter's diagnosis, the medical system's treatment options, and the road Aaron was forced to take to get his girl the best care possible. As a clinical researcher, Dr. Hartman has been involved with over 70 clinical studies. He's the founder of the Virginia Research Center and currently is serving as the assistant clinical professor of family medicine at the VCU School of Medicine. In 2016, he founded Richmond Integrative and Functional Medicine, where he focuses on caring for complex patients that have fallen through the cracks in our current healthcare system. Welcome back to the show, Dr. Hartman.
Great to be back.
When we talked about SIRS years ago, great, complex topic. Topic of today, maybe just as complex, actually. But tell us the story behind your book. So congratulations, of course, writing your book.
Thanks.
But tell us the story behind that. How it began.
Basically, and us, my wife and I personally, so I'm gonna try to
Yeah, yeah.
pretend like I don't know who you are and give you the whole spiel, right? So for your audience, but my wife is a pediatric occupational therapist. Her specialty was kids with special needs, and when Anna's foster home was closing, my wife said, "Hey, would you mind bringing this little girl into our home?" And so I
Yeah.
said, "Sure." I said, "Sure, yeah, let's take her for a spin, right?" And trying to do everything as best you could. And one of the first things was feeding. Kids with cerebral palsy, brain damage tend to be small for gestational age, failure to thrive, lots of feeding issues, lots of health issues. So we're just trying to do the best we could to for her to
Yeah.
be the optimal version of her, whatever that was, and doing the best we could. And the GI doctor was like, "Yeah, fail, not good enough." So the next thing we do is put a feeding tube in her. Okay, so we can pour some formula, sugar water into her belly and put some meat on her bones
How old was
because she's
she back
she
then?
was at that stage, probably about 14, between 12 and 14 months. I think about 14
Really
months.
little. Yeah,
Yeah,
yeah.
really little. And the GI doctor was like, now my wife and I had conversations. Anna was never supposed to walk or talk or crawl. So the healthcare experts kind of placed the bar like ridiculously low. But we had higher expectations for her. And like part of chewing and swallowing is speech development. Crawling, you do your little army crawl, then you work
Mm-hmm.
to like kind of trying to practice. We can't do that if you got a plastic tube hanging out of your belly.
Oh,
So
sure.
yeah. So we're just like, we're not going to do that because that's going to impede her.
Development.
Um,
Yeah, yeah.
yeah. And so what happened? The GI doctor reported us to Child Protective Services for medical neglect because we refused to do what they said. And so we got investigated, and that was interesting. It was kind of funny, to be honest with you, because the nurse that came out and investigated us was someone my wife worked with. My wife actually worked with a lot of patients from that doctor. So they kind of talked about how the doctor liked to put tubes in every kid and proceduralize them. And unfortunately, that's the system in a lot of Medicaid type environments. And so that was the first inflection point for me. Like the system doesn't like it when you say no, and sometimes they can react very aggressively towards you. Um, but the big inflection point that really for me was like, I have to figure this out was 6 months later when my wife found a growth chart for kids with cerebral palsy with my daughter's diagnosis. And she was 50 percentile, right in the middle, normal for her situation. And so all of a sudden, I was like, the specialist doesn't know this existed and was going to recommend a medical procedure. And you know how this happens. You get one procedure leads to another, leads to another.
Uh-huh.
Um,
Uh-huh.
to put things in perspective, the average adult, my daughter's 19, getting ready to turn 20, at her age with her diagnosis, has had 13 surgical procedures by the time they're her age. She's had zero. And so
Wow.
once you start
Go dad,
once,
go mom. Yeah.
yeah, it goes down to so all of a sudden that was like the specialist didn't know that she was normal and they pushed against us. So how do I figure things out within the system? So I just basically jumped outside the system and was super desperate, was like, I gotta figure this out. And so started with the first thing I came across, which was Dr. Amy Yasko and a lot of her nutrigenetic, like doing gene testing and figuring out nutrient deficiencies. And that kind of was my first, was my,
Dabble into
my,
functional medicine or
yeah,
yeah,
exactly.
yeah,
100%. Yeah,
yeah,
was my
yeah.
first thing. Like there are other people out there, and that led me to find a pediatrician who worked with autistic kids. And there's not a lot of data out there on kids with cerebral palsy. So a lot of this was translational medicine, like what's the closest neurological issue in kids, right? And sometimes I was going to Russian literature because they do a lot of interesting studies on kids like this in Russia. And you're looking at European, Eastern Europe literature. And so doing that year after year after year, you get off the beaten path and, inch, 2, 3 inches a foot. And all of a sudden, 5, 10, 15 years later, you're like in a totally different world doing really cool stuff with lots of patients.
And here you are. Okay. So your book must talk a little bit about soil health. So tell us
Yes.
the connection between, well, soil health, no, soil and our
Yeah.
health. So does healthy soil directly affect our human health?
100%. So part of our journey was we were a little extreme, maybe. And so part of it was, hey, we want to have the optimal healing environment, the optimal family environment. So my wife was like, let's homestead. She read this book, Animal Vegetable Miracle, which was this family's story. And they basically decided to homestead and for a year, just basically ate whatever they could get locally in the environment, minus everybody had their like special thing. And the thing about it is like, okay, we're having a farm, we're out here, like let's raise cows, let's raise stuff. So I started researching, well, crud, cows are kind of expensive, and if they die, it's a big negative. So let me start researching animal husbandry, start look at, Joel Salatin, Sir Albert Howard, a bunch of actually ancient wisdom on how you raise healthy, not ancient, like in 20th century, right? And started realizing that there's a direct correlation with soil health and what the soil grows, which are grass and plants, and then the animals that eat that stuff. And so started
And
realizing
then we
that if
eat
you have,
that stuff. Yeah, yeah.
well, if you basically, Joel Salatin, the way he says it, he does not raise cows, he raises a salad bar. He raises fescue, he raises grass. And the side effect of high quality grass is amazing meat, amazing chickens, amazing poultry, amazing pork, But one level below that is you have to have healthy soils that have healthy balance of bacteria, yeast, fungi that actually, where do minerals come from? Where do the 98 rare earth minerals, trace minerals come from that you and I need to survive? It comes from minerals and dirt. Okay. And the rock have to be dissolved and made from inorganic to organic so that plant can incorporate it, and then you incorporate from the plant. So all of a sudden, went down this whole pathway of rare earth minerals, trace minerals, micronutrients that you need like in picograms, like in like smaller specks for your health. And that comes back. And how do we get those? We eat things that concentrate it for us, that eat healthy plants that grow in healthy soil. And so all of a sudden now it's like a fourth order thing. If you want to be healthy and your family be healthy, literally you have to have healthy soil producing the foods that whatever either you eat or what eats that. And so that was like a 2 to 3 year journey of studying soil health, agriculture, environmental medicine. That led down many other rabbit trails. That's kept me preoccupied for about 10 years.
So then did you implement what you learned and grow your own food and raise your own animals to feed your family?
Yeah. So one of the things, I learned is that if you ever go to an organic ranch, you'll see some blind cows. And you might ask yourself, well, why are there blind cows here? And it's because they don't use antibiotics. And part of that is you do not put antibiotics in the feed and you don't give your cows antibiotics. So all
Okay,
the
this is silly,
flies,
but how would you know the cow's blind? How do,
because their eyes are basically hazed over white.
oh, okay, okay.
Yeah. Because what happens, and you've been to cow, farm, they have flies everywhere, right? And
Yeah,
they
yeah,
get
yeah.
conjunctivitis, they get little small eye infections. Well, if they get enough of those and don't get antibiotics, they can go blind. And so talking with Joel Salatin, which he's an amazing guy here in Virginia. He's
Yes. Yeah.
you familiar? I don't know
Oh,
if you heard him.
oh, I've seen his documentaries and yeah, he's interstate. He's
Yes, he is.
interstate.
Yes, yes,
Yes.
yeah, yeah. So
Okay.
I've actually, yeah, he's a great guy. But I'm talking to him and he's like, yeah, when I started doing this, I was having some cows go blind. And when I started supplementing with kelp, I've not had, when I talked to him, this was probably 10 years ago, but he's like, I've not had a blind cow in over 20 years. So all of a sudden the light bulb went off my head. Ooh, selenium. Where then all of a sudden my brain topped to Keyson's disease. There was actually this outbreak of cardiomyopathy in China back in the 60s or whatever, where kids were getting heart failure, basically. They get a viral infection, get heart failure. It was a big project to create a vaccine for that virus. It was like a CMV variant. But come to find out, it was induced by chromium deficiency in the soil. And so all these people had this deficiency and they got set up for this cardiomyopathy. So all of a
Wow.
sudden now I'm like connecting all these dots. Maybe it's the rare earth minerals in the kelp that's boosting the cow's immune system so that they're healthy and he's having these amazingly healthy cows. So I basically started supplementing my cows with kelp. The other thing about
Did
cows
it
that's
work?
interesting,
Did it work?
well, the meat is this really deep, it's so red. It's really interesting how deep red the meat is when you eat it. Um, I've only lost one cow actually, and it was to actually acorn poisoning. Part of this is a learning process, and I
Of
didn't
course, an
realize I was.
extensive learning process. But did fewer cows go blind? Like, was that hypothesis correct? And did it?
I've never had a cow go blind.
Oh, okay,
And
okay.
Joel, and last time I talked to Joel, he's not had one yet either. And he has like hundreds of them. So it actually worked. But the point is like, where do we get this stuff from?
Right, right.
We and it's like we don't get. You're not a cow. You can't eat 18 hours a day. You don't have four stomachs. You're not a ruminator. So where do you get the same things that other mammals need? And it's by eating things that concentrate it for you. It's from healthy chickens, healthy cows. And so all of a sudden start realizing if I want to be healthy myself and my kids, I have to make sure we're eating healthy animals. But that gets you down this whole pathway of things like bone broth, for example. How did
Sure.
people in antiquity get lithium, strontium, barium, silica, like these things you need for like to prevent osteoporosis, you need for healthy connective tissues, bone broth, right? And so all of a sudden now it led me down all these different pathways about how you can literally use food like a drug. And that led me down to making, what I call brain mayo. We actually would check our kids, omega-3, we do a fatty acid analysis on my kids and my family and see what the deficiencies were. And then we'd use a balanced omega-3, 6 lipid to make mayonnaise. So all of a sudden now it's clean, cold processed omega-3, 6, 4-to-1 ratio of omega-6s to 3s. And then we make mayonnaise. And all of a sudden now I can actually fix my kids' brains. We make homemade granola, but we do it out of grains, seeds, nuts. No, I'm not grains. No, seeds, nuts. No oats. And I do the ratios of oats, walnuts, pecans based on the kids what they needed. And all of a sudden, I'm using food like a drug for their brains. So it kind of led me down a lot of
Very
really
cool.
cool.
Yeah, yeah. Are
A
those
lot of cool.
recipes in your book? No.
They are not. They're in my head. I've actually put them on social, but they're not in the book. No, I probably should put them somewhere. They're if people follow me, it's like out there in the ether.
Well, speaking of healthy fats, so like what was one of the biggest challenges you encountered while trying to heal your daughter's brain specifically? I mean, we know healthy fats are so important there. So did healthy fats play a role there? What was maybe a big challenge?
Well, we talked about sewers, a couple of years
Yeah,
ago,
yeah, yeah,
and
yeah.
one of the things is like your body stores toxins. A lot of the environmental toxins, particularly for women, are stored in fat tissue. And so all of a sudden, if you're consuming toxic fats, trans fats, whatever, they're going to be inflammatory and they're going to hold on to toxins. And so all of a sudden, how do you get this out of your body? And that's where phosphatidylcholine, phospholipids come into play because they act like soap, literally for your cell membranes. And then healthy ALA, which is the essential omega-3, actually is a primary free radical scavenger protector for cell membranes, which is a fancy way of saying it keeps your cell walls and membranes from getting inflamed. So all of a sudden, we start realizing these things can actually help my daughter's brain to heal. These can help my son who's got ADHD and dyslexia. These can help my other daughter. And so all of a sudden, start using these. And oh, by the way, I have kids come to my clinic with eczema, asthma, autism, and you start testing them and realize these kids have similar fatty acid issues my kids have. Let's try this cocktail basically. And all of
Sure.
a sudden, kids' eczema gets better. Their autism, they're like, their speech is improving, and all of a sudden, they're not, the regression goes away, and you realize that a lot of the brain issues we're dealing with in kids right now actually comes down to the advanced science of lipid medicine, which is basically healthy fats for healthy brains.
Yes, and so nuts are one way to get some of those fats. Back to what
Correct.
you were
Yes.
saying, using food as medicine. Yes. Okay.
Yes.
You talked about blind cows, but what about blind spots? So, like, what are blind spots in, well, I'll say critical medical blind spots
Yeah.
that, we as practitioners maybe have missed in the past? Why is understanding blind spots so important in today's world of high-tech medicine and AI?
Actually, this is very timely since I know this might be a passion of yours. A big blind spot that just came to light maybe a month ago. Did you know hormone replacement therapy is actually good for people now? The
Oh,
FDA just,
yeah, yeah. I
yeah,
just learned that. Just kidding.
no, well, me too. Like when the FDA told me a month ago, it's okay. They took the black box warning off of it. And so if you look at some of the data going back to 2002, which is when the Women's Health Initiative happened, potentially 140,000 to 160,000 women died prematurely over the last 23 years because of lack of access, right? Or being dissuaded from using dangerous hormones, right? Um, Hormones can actually, when you're in the menopause stage, can actually lower your risk for heart disease 50% and
Hmm.
your risk for dementia 35%, 38%. So I was actually talking with Dr. Mark Houston, who he's like
Hmm.
the vascular biologist of the universe. He's amazing. I was at a course with his couple weeks ago, and he was like, if you have a patient come in, a female who has high blood pressure, high cholesterol, and is in menopause, what one intervention lowers their risk for heart disease the most? Not treating cholesterol, not treating the blood pressure. It's hormone replacement
HRT.
therapy,
Yeah.
HRT. And so now we can talk about it, not get canceled, et cetera, et cetera. But literally for
Right.
23 years, it's been verboten. It's been malpractice. It's been, you have to sign a crazy consent form. And so now take that and multiply that by a
Yeah.
bunch of other stuff. Multiply it by peanuts is another great example. The American Pediatric Association about 2000 said, oh, peanut allergies, we should not have kids eat peanuts till you're after 3. And what did we see? We saw a 500% explosion in peanut allergies. Um, study 2015, lo and behold, actually eating peanuts early can lower your kids' risk for peanut allergies 85%. The experts were 100% wrong, right? So all of a sudden, blind spots are things like this that are preventable, things that we think are right or that are just plain wrong, that later we find out to be false, right? And these are everywhere. Historically, we used to treat mental health issues with frontal lobotomies. Silly doctors in the 1950s, right? Um, every female with breast cancer used to get a bilateral radical mastectomy, right, all the way down to the muscle. So we're so much so much better than those arcane doctors from 30, 40 years ago. We're making the same mistakes. It's just part of the blind spot is we just don't realize them quite yet. And so part of my realization in the last couple of years was coming to understand that potentially medical error might be the third most common cause of death in our country. Iatrogenesis, medication side effects, procedure side effects. And this is actually coming from Medicare actuaries, right? So my question is, if this is coming from Medicare actuaries, is it actually bigger than, I think it's something like 275,000 people a year die from medical error in the Medicare population. So the
Hmm.
question
Hmm.
is, if you add women, pregnancy, kids, is it actually number 2 or number 1? We don't know because we don't talk about it. That data had to be published actually in the British Medical Journal because no journals in the United States are willing to publish that work from Dr. Marty McCary. And so all of a sudden, it's like we have so many blind spots. And so I think one of the things is realizing that part of my job, as a physician, is first and foremost do no harm.
Hmm.
Sometimes doing no harm means doing nothing when appropriate, versus our current malpractice technology-based medical culture is you have to do something. And many times doing something is more harmful than doing nothing. Another big blind spot, antibiotics. Kid comes in, runny nose, cough, they feel cruddy. Give them antibiotics, it won't hurt them. Oops, another oops. Now we know obesity, diabetes, autoimmune issues, like all the things that consuming antibiotics excessively at a younger age or during pregnancy can actually cause in kids' adult lives. And so and I could go on blind spot after blind spot. I mentioned in the book, but it's things that our healthcare system just turns a blind eye to and ignores.
Yikes. And did you find any of those specifically with your daughter? You kind of mentioned one, but
Well, I mean,
the whole growth chart, yeah,
um,
being unaware of it, yeah.
when you have people that are in really severe medical conditions, whether it's post-stroke, post-MI, chronic fatigue, fibro, long COVID, in the special needs world, kids with autoimmune issues, autism, orthopedic issues, my daughter's issues with cerebral palsy, and there's not a good standard of care, accepted medical practice. Many times procedures, surgeries, are recommended, which have a lot of complications. And so one of the blind spots I realized, it's one of those things and my wife kind of showed this to me, her being a pediatric occupational therapist. She had some kids that were getting surgery every 6 months, every year. We're getting massive, yeah, I know, in childhood. And
Mm.
it's just like just avoiding the surgeries for my daughter radically changed her trajectory. She's getting ready to turn 20, and she's actually slated to be moving out of our house April.
Wow.
So the kid
Wow.
that was going to be a
Told she
vegetable
would
is
never
actually,
crawl, never walk. How is
yeah.
she? Is she walking now? What is she doing now?
But as far as no, she's still a mess. I don't want to make her sound like
Yeah, yeah,
she's
yeah,
like,
yeah.
perfect, but she's
Comparatively, though, yes, comparative.
well, I mean, she can do like most of her ADL. She needs someone to watch her and support her just in case
Yeah,
for some things. She can pretty much do all of her showering on her own. She is in a wheelchair, but she
yeah,
can
yeah,
transition to the
yeah, yeah.
toilet, get in bed by herself. As far as speech is concerned, I mean, my daughter's a joy to be around. She has so many people that love her. I mean, she spends probably a couple hours on the phone every night talking to all of her friends, texting all of her friends, you know. Um, she's just this beacon of light that people love being around. And it's like she was supposed to be a vegetable in the corner that was speechless. And now she's moved out of the house. And it's just really kind of cool to see how, and she's takes charge of her health. She's like the boss. She knows where everything is in the house. She like reminds me, Dad, don't forget your meeting at 3 o'clock today or whatever. Don't forget your interview or whatever. And it's just kind of, I remember one time 5 years ago, she was talking and doing stuff, and I was like, "Oh my gosh, would you please be quiet?" And my wife was like, "We prayed a lot and paid a lot for this. So just remember that." And I was like, "Ooh, you put me in my place." So my wife, she'll do that from time to time. I need it. I need it from time to time too. So
How does she feel about this book? What are her thoughts on her dad writing this book on this journey? And
oh, she loves it. Oh, my daughter, she loves it. She's like told her friends about it. She's like, "Oh, you gotta read my book." No, actually, she says, "You have to read my book." That's what she's like. She's like, "It's my book. It's about me." I'm like, cool, cool. So she actually on my
because of you, yes, yes,
yeah. Well, she lived one of the things she does is listen to books on tape. So she,
yeah.
goes in that, and so it's really funny. One of we met Dr. Cialdini, wrote the book Influence, and so she listened to it, and she met him, and he signed a copy for her, and so she would listen to his book on influence. And I think she's learning how to influence people, so it's kind of scary. But she would actually listen to it UnCurable at night and be like, "Dad, can I listen to my book tonight?" And I'm like, "Sure." So
Oh,
but she's really taken to it. But it's ultimately my point of writing the book was if this little girl who was exposed to crystal meth her entire pregnancy, who was born blind, who had a stroke before she was born, can literally beat every odd and every
yes,
prognosis, then
yes.
you can too, And so, and the hope is that people will read it and be like, you know what? I can do this. And it's over. It's been a 19 years journey and still is a journey. She's still improving every year. 5 years ago, she couldn't read and couldn't write. Now she can pretty much read normal size font. And now her fingers are working good enough. She's actually able to text on the phone without any assistance. And so she continues to get better. So her story is not stopped. It's continuing on forward. But it's been a 19-year journey. So it's been a bit.
Long, beautiful journey. Yes. You kind of already answered the next question I was going to ask. So I was going to ask, what's the standard of care and how did following the standard of care actually
Mm.
hurt your daughter? Do you want to expand on that? I mean, you kind of already
Well,
answered a little bit of that. Yeah.
the standard of care is kind of like, people say, well, what are you doing? How that's not the standard of care. And the standard of care, it's the standard of care. The idea is like, what does a group of board certified specialists, practitioners, doctors, what do we all agree on for managing blood pressure, cholesterol, broken leg, heart attack,
Hmm.
CP, whatever the diagnosis, what's the standard we all agree on? And people take that standard and make it the goal versus the floor. And the way to think about it is if you get a group of experts together, what can they all agree on? And they agree on all things they share in common. They don't agree on the latest research. They don't agree on their fields of expertise. They only agree on the common knowledge we all can accept, right? And so people treat the standard of care as if it's this goal, like, oh, are you doing the standard of care? I'm like, I mean, yeah, like standard of care is like the bottom of the barrel for me.
Right,
It's like
right.
we
And
shoot
yeah,
for
standard of care.
yeah,
And yeah, yeah, we're shooting for
yeah,
far above that. Yeah.
100%. So when people say standard of care, they talk about it as if it's the goal and it's the floor. It's kind of like, oh, I'm a board certified doctor or what XYZ. And like, great, you've got it. You got the ticket to the party that says insurance will pay for your bill. Congratulations. You can now start learning, right? And so we treat these certifications, board certifications, standard of care as if they're the goal. And it's literally just it's the floor, it's the ground, you should at least do this. If nothing else, you should do this. And that's where I think, the way I think about standard of care, it's like everything I do has to at least be as safe and as effective as standard care. And if it's not at least as safe and effective, I will do something else. And the good news is there's so many things I do that are safer and work better than the standard of care.
Good segue to the next question. So, are people really getting sicker? Are we getting sicker or healthier as a society? So, we're supposed to be living longer, healthier lives in
Um,
today's modern age, but how is this going the opposite direction?
depends on which podcast you listen to and which group you go to in your philosophy. Some people are saying we're going to live to be 150 years old and we've cracked the code on longevity. Um, And then I look at people in my clinic and we see that 1 in 2 people in America right now will get cancer in their life, which is a pretty crazy statistic. In 1990, it was 1 in 3. In 1900, 1 in 100 people would get cancer in their life.
Wow.
That's so, I mean, cancer's getting
Why do
more.
you think that's on the rise? Is it the toxicities? Is that the biggest, do you
Well, the
think,
question,
contributor?
what causes cancer? Is cancer a genetic disease or is it a metabolic disease? And if it's
Metabolic.
well, again, some experts say it's genetic, right? And if it's genetic, then it should be getting better since we discovered the human genome, right? But
Eh,
um, yeah, I refer to like the BRCA gene, right? In 1950, if you had the BRCA1, BRCA2 gene, your risk for breast cancer was 20%. If you have the gene, those genes now it's 80%. So even with the gene, the risk has quadrupled over the last 70 years. And your question is why? I feel like it's a lot of the chemicals in the environment. NHANES, which is a national government organization that checks, the waterways, checks the air quality. And they do these random toxin checks on humans, people. And right now, the average American, if you do a urine, it's looking for environmental toxins, chemicals, PFASs, heavy metals, et cetera. The average American will have about 13 positives, about 8 high level, 95th percentile, and then like the 50th, 70th, the 75th to 95th percentile, which is that yellow zone, about 8 people. So 13. 10 years ago, it was 7 or 8, and 20 years ago, it was 1 or 2. So just on NHANES federal government
yeah.
testing, we've gone from 1 to 2 level in the average American to 7 to 8 to now 13. And so I think there's a very, very strong argument for
Yeah.
maybe the increased cancer, autoimmune issues. It's not the only thing, but it's a pretty big thing, the toxins in the environment. And when you get into the whole food conversation, eating real food, like
Yeah.
processed foods are a conduit for chemicals and toxins.
Yeah. Source of toxin. Yeah, exactly. Yeah.
Yeah. So to your point, yes, I think there's a lot of things we could talk about. You can talk about, decreased sleep. There's a correlation with decreased sleep and obesity, sleep apnea, metabolic syndrome, cancer, breast cancer, prostate cancer. Well, the average American now sleeps 6.5 hours at night. Mid 1800s, the average American slept 8.5 to 9 hours at night. So kids that need, high school student needs about 10 hours of sleep a night.
Mhm.
Middle school student needs probably 12 hours. They're getting to the bus at like 6 in the morning, right? They're Our kids are chronically sleep deprived. There's so many different things. Chronic stress. We know that stress can actually elevate cortisol, can drive insulin resistance, and those are two major metabolic factors related to cancer, metabolic disease.
Mhm.
Where are national stress levels? So there's so many things going on right now that I think that contribute to this. But I feel like one of the major, if not the major, contributing factors are toxins in the environment.
Sure. You seem to know a lot of statistics. So do you know where national stress levels are? I mean, we would presume they're very high. Do you know any stats on that?
You know, like how do you measure stress? No, we
Right,
we
right.
tend to measure like how many people are anxious, how many kids are taking medications. When you look at like how many kids are seeking help for anxiety, panic, depression, when you
Yeah.
look at something like 40% of kids take a drug, look at diagnoses in children, obesity, childhood obesity, something like 30%.
40,
Um,
40% of kids take a drug or a psych drug, like a mental health drug.
a drug. Well, the most commonly prescribed right now in adolescence is going to be like an ADHD psychiatric
Sure, sure.
medication.
Okay.
But if you add those plus other stuff, it's the pretty high numbers. And and then you get to the thing that 30%, there's actually a textbook about this. About 30% of drugs currently on the market are mitochondrial toxicants. So if you take 3 or 4 medications, odds are one of those is toxic to your own mitochondria, which
Mitochondria.
are your,
Yikes.
yeah. And so there's so many things. It's a big messy soup, basically.
Yeah.
And throw on top of that, my daughter's situation, my family, we adopted our kids, and we just realized we had to perfect the basics: clean environment, clean food, clean air, clean water, safe environment, healthy relationships. If we wanted our kids to heal and be the best version of them that they could be, we really had to perfect the basics and then add all the cool stuff on, which was, for my daughter, everything from stem cells and cerebral lysin and peptides to hyperbaric and
Oh, I
nutrigenomics
want to
and
hear more of that. Should we go there now? I mean, oh, I hope you and your wife are very proud of. I mean, yes, you went far and beyond just the typical foundation. You solidified a strong foundation and you've built layers and layers upon that. So what were some of the big needle movers for her specifically?
more
Even for
specifically,
brain health too. I mean, yeah,
it's well, one of the big movers, the average kid spends like 6 to 8 hours a day practicing walking. And as you know, physical activity, using your muscles release these myokines, increases BDNF alpha in your brain. And there's all this data like using your body uses your brain.
sure.
Um, and if you use your body a lot in child when you're developing, you will develop better neural pathways. And so we realized for her, she had to be physically active. But how do you have a kid who can't walk,
Yeah,
who can't
yeah,
crawl? And so
yeah,
we found this thing called suit therapy, which was used in Eastern Europe for cosmonauts to keep their muscles up in
sure, sure.
space. And it was basically a suit, like a suit with rubber bands in it. And she'd get in this cage and kind of hold her up, and she'd bounce around. The therapist would work with her. And so we did that. We do these intensives for 3 hours a day for 3 to 4 weeks at a time, and then at home try to do therapy with her. And all of a sudden, she started crawling. We treated her like an elite athlete. We're going to put you through. You're getting ready for the Olympics, starting at 3, but it's not the Olympics. It's basically we just want you to crawl and walk, right? And it was interesting to see how that affected speech, that affected cognition, thinking, just having her be physically active. That was like a big, big needle mover. Um,
But for
Another
any
big,
child, that's great just for the listeners to hear. I mean, it's so
yeah,
important that your kids at a young age are physically active. I have two little boys, and oh my gosh, sometimes I'm like,
yeah.
they don't. Now I have this broken patella. I can't barely chase after my
Uh,
children, but that's okay. I'm just gonna let them run wild and hope they don't fall down.
well, if you look at a lot of these elite schools in the UK, like Eton or these elite schools up in New England, what do they always have as a part of their higher education? Everybody's got to be in a sport, right? Athletics. Like, why do they do that? Strong man, strong body, strong mind. We kind of know intuitively that if you want to have a strong mind, you need a strong body, right?
Sure.
And yet, our educational system is like sit in the chair. And if you can't sit in the chair, we'll give you some medication so you can sit in the chair, right?
Yeah.
And so knowing those things and knowing that for brain development, you have to develop these neural pathways. We just try to make her as physically active as possible. That led down a bunch of different pathways. One was using a Galileo machine, which is it's a alternating vibrating foot plate, which now become popular now. But one of the things I learned was in traumatic brain injury patients or spinal cord injury patients, you can actually activate neural pathways that are kind of like walking by doing alternating vibration. And so how do you stimulate to your brain 8,000 steps a day when you're not taking 8,000 steps? Well, 10 minutes on a vibrating foot plate, vibrating at 18 hertz can do that for you, right? And so
Yeah, we
that
kind of
actually
found some
started,
biohacks for her. Yeah.
yeah, we did, that was one of the many things. Another one of the big movers, she had, obviously traumatic brain injury, stroke when she was born, and tone issues, clonus, which is her muscles would kind of jerk and stuff. And some of the surgeries that are recommended were cutting her heel cords, cutting her hip flexors. They had one surgery that was recommended cutting her spinal cord, right? So to help with her tone. And we just opted not to do those because we just, again, they just make you look better in a wheelchair, but not make you functionally better. But what do we do? What do we do? So started researching functional neurology and realized you could use neuromuscular stimulation, use electricity to stimulate muscles to change neural pathways. And so one of my patients, gotta listen to your patients here, um, was mentioning to me, hey, I found this device, and it's for circulation in your feet called Revitive. It was FDA approved to treat swollen feet. And I saw it. I'm like, this is exactly what I'm looking for. It's a foot plate. You put your feet on, and it basically activates your calf muscles to clamp down and make sure, and you push the foot plate. So it's like doing calf raises while you're sitting down, circulate the blood. Well, for a kid who can't stand and walk, who has no calf muscles, who's tight, this is exactly what I want to do. And so over 6 months, almost all the tone in her legs went away. And so this was a $300 device that prevented a $400,000 to $500,000 surgery, you know.
Wow.
And so we have so many examples of these little hacks. Some I discovered, some my wife discovered, some patients mentioned to me. And I'm like, wait a second, that's what I'm looking for, Hyperbaric was another big one,
And
particularly with her
explain
vision.
why and how that's so helpful. Yeah.
Well, again, we've all seen kids like when they're born, everything is reflexes, right? You touch the cheek, they turn. Moro, it's a basic, stroke the foot. They have these basic built-in reflexes. They can't walk, they can't really crawl. And what happens, they start to, I want to touch that thing. They'll start trying to do stuff and eventually through practice, develop the pathways to grab something, to drink it, to start walking, et cetera, et cetera. But through physical activity, you start making these neural pathways. And as your brain develops, you start actually this thing called pruning, where you'll kind of prune dendrites. And these are the pathways for walking. These are the pathways for playing a sport, et cetera, et cetera. And that process really continues for women till they're about 25 and men till about 28. So your brain's plastic till your mid-late 20s, right? Well, for her, she never developed those initial pathways. And so we're starting at 4, 5, 6, 8, 10, whatever the age is. Like, how do you do that in that kid? How do I activate those pathways to try to get you to like be able to stand? Because with a kid with cerebral palsy, like if you can't stand, if you're a fall risk, if she falls and hits her head,
Sure.
she has a brain injury. So all of a sudden,
Yeah,
just the
yeah.
ability to stand without falling is a big deal. Just the ability to like lean over and pull her pants up and pull them up after going to the bathroom is a big deal. Well, how do you develop those skills, right? And so realize if I can stimulate the muscles, and they've done, Chris, if you remember Christopher Reeve,
Hmm.
Superman, he actually was here from Virginia. He actually had his horseback riding accident in Charlottesville. And those of you who remember him, he was actually able to walk again, even though he had no communication. They would actually, through muscle stimulation, could actually get his body to stimulate to walk. And so, even with no communication, so it's like, can
Wow.
you, I do this with my daughter? And the answer is yes, and I did. And so it's like, and that's where part of what I did was translational medicine was like, people say, what are the randomized, double-blind, placebo-controlled, government-approved, pharma paid for studies that say you could
I'm
do
not
that?
going
And
to
I'm
wait
like,
65 years for that. So, yeah.
yeah. Or pay
Yeah.
hundreds of millions of dollars for my daughter
Right.
to be able to use a $300 foot plate, right?
Right.
And so a lot of translational medicine is saying, this works in a rat with a brain injury. I've read about LD. I've read about this working this thing. The biological plausibility it could work in my daughter. And what's the risk? It's a buzzing device. It's electricity, right? And so all of a sudden, let's try and see what happens. And it's really interesting when you start doing this, you find out, wait a second, elite athletes do this? Bruce Lee, I'm dating myself here, pictures of him. He's been popping up on my social feeds for some reason recently, but he would actually, part of his workout was actually putting muscle stimulation devices on his muscles to actually activate them to improve his strength
Yeah, yeah,
and speed.
yeah.
And so it's all of a sudden, it's like, well, if the elite athletes can do it, why can't I do it with my daughter and other patients
Right.
without, RTC trials that are approved by the government and stuff. And that's like what translational medicine is taking that bench research and translating it today, not waiting for
Mhm.
the 30, 40, 50 years to get the bench research to standard of care.
Sure. So bringing it back to hyperbaric oxygen. Yes.
Yeah.
No, that's okay. So how did that, well, again, if you can, we've talked a little bit about this on the show, but can you kind of explain the purpose of that, but how it helped your daughter too?
Hyperbaric oxygen is this really amazing thing that was first used in the 1600s. It's been around for a long time. We know a lot about it. And it basically improves blood flow to places in your body, including your brain, that have poor oxygenation. Great for traumatic brain injuries, great for stroke patients. If you have a cancer, cancers don't like oxygen. They're anaerobic. They actually make a lot of lactic acid. You can force oxygen into those cancers with diving at 1.5,
Mhm.
2 atmospheres, 100% oxygen. So I knew it was good for traumatic brain kind of things. The question would be like, okay, my daughter, when we did it with her, she was probably the 14-ish years old range. Would it still help her? Don't know. So we drove to Charlottesville, which was an hour drive from here, and did that. And immediately her vision started improving. At that point in time, she couldn't even write the letter A. My wife had worked on her handwriting for years. And after doing like a couple of weeks of hyperbaric, she was able to write her name. My wife just started crying because it was like, oh my gosh, like
Yes,
we've worked for this for
yes.
years. But then her vision, like she's like, hey dad, I can see you across the room. I'm like, huh? Because she one of her issues is she has cortical blindness
Yeah, yeah.
and she has no pallor in her optic disc. So like there's no color there, and her occipital lobe back in the back of the brain wasn't functioning. So she had, even though her eye anatomy was fine, the neural pathways for vision just weren't there. So she was functionally blind. And all of a sudden she's like seeing things across the room, et cetera, et cetera. So we just kept on doing hyperbaric, got a chamber for home, kept on
Hmm.
doing it. And we've seen her vision improve. And we've actually, now we're doing phosphatidylcholine therapy and some lipid therapy, IVE,
Hmm.
and done some other peptides like subralizin. And recently now she's actually able to read well enough that she doesn't have to make the her phone, she doesn't have to blow it up. She can read it now at a normal font, and now with the normal size screen, actually type with her three fingers. So but hyperbaric has been a staple for that. And it's interesting. It's like how many different, traumatic brain injury, long COVID. It's interesting, a lot of cool research with long COVID, with the brain inflammation from that. Um, Chronic fatigue, fibro, kids with autism. So many cool things that hyperbaric does. It's just not paid for by insurance.
Sure, sure. Okay, well, how can we protect ourselves from our own doctors? So back to kind of medical error. I want to come back to that. So if medical error is the third or maybe second leading cause of death in the country, it seems that being an educated patient would be critical. So how can we protect ourselves from the system that's supposed to help us?
That's where it's hard because we have um this probably resonates more with younger people than it does with older people. Probably resonates more with people that are more educated than less educated, but it requires an educated consumer. It requires a proactive individual that's going to take an active part in their care. You can't be passive in this. And so those days are over. The days of, the appendix removal saving your life and the antibiotic for pneumonia. I mean, that's people don't die of pneumonia and they've died of cardiovascular disease, neurological issues, cancer. And so you need to be really, really attuned. It's just basic, learn the data, learn the information, be proactive, and then get a practitioner or a provider or someone that will work with you that's open to your ideas, open to you having ideas, open to you even having ideas, right? Open to you bringing ideas to them. And I think that's where it starts. And it's getting educated, find good sources, good podcasts like yours, good data, good blogs, good books to read, that they can actually like become educated. I think just and with AI and everything that's happened with that in the last year, I think that's empowered people to even be even more empowered to
Mhm.
take charge of their health.
Agreed. You've already shared so many, but are there maybe just like three major takeaways you learned from your daughter's healthcare crisis and your interactions with the healthcare system?
So I think the first one is you really need to, whatever happens, you trust your gut. I actually talk about this in the book. The idea that,
I say the same thing in my book. Just you got to trust that instinct. That's so
well,
powerful.
there's
Yes,
all
I
this
wouldn't have my second child if I didn't trust that instinct. Yes.
there's so much neuroscience now behind actually you do have a brain in your gut and it does talk to you, but it talks to you through like that hunch, that feeling that
Yes.
it affects your body, your blood pressure, like that inner kind of what, like that feeling. Um, you got to trust it. And so if your doctor says, "Hey, I want you to start on this medication," is it life saving? If you don't start it now, will you live or die? Right? If it's like I want to start you on statin for your if you're a female actually, and you're 50 and have no other risk factors, and they want to start you on statin, you know, doesn't feel right. Well, maybe research it a little bit. Maybe find out that when you get in the menopause, a statin can increase your risk for developing diabetes, maybe up to 45%. Huh. That's not good. Statins induce certain nutrient deficiencies can cause. I've had
Not
patients.
well studied in women in general. Yeah.
Well, that's another time. That's another blind spot. That's another thing. But all of a sudden, well, then maybe what are there other things you can do for that cholesterol number? Is that cholesterol number actually the bad thing?
Right.
This is I actually learned this data point about a year ago. I can predict, Stephanie, your 30-year risk for heart disease based on three numbers for a female.
Okay, tell
It's
me.
your it's your LP it's your LP
LP
little
Lillet.
a,
Yep.
it's LP little, your LDL particle number, and your HSCRP.
Okay.
Okay,
I don't know
50%
them
of
off the top
people.
of my head, but last I looked, they were all good.
Well, there you go. Um, so are we focusing on the right numbers, particularly in women? You know, and if you have a question and with all the tools that are out there, really, I don't want to say there's not an excuse, but people can find answers. And so I just encourage people to find reliable sources. One of my big things is education. So I've vetted like over 500 books, that I've got like a book reading list of about 80 books on my website. My pod, you've got hundreds of episodes. I'm like,
Yeah, yeah,
episode
yeah.
105, 105 or whatever, but I've got like 400 some blogs, but just find sources you can trust that are from reliable people and just start getting educated. And I think that will inform your intuition. That will inform your gut to make better
Yep,
kind of decisions.
yep, yep. Good. Okay. So after reading your book, you also kind of shared this too, but what would you expect people to take away that would genuinely change their life and their family's health?
I would say, never give up ever on yourself, your loved ones. There are always answers out there. and you might find it a year, two, three from now, but never give up. Trust your instincts. And you gotta perfect the basics. People a lot of times, especially in today's age, will like, what's the fanciest new gadget, or the tinted glasses, or the, you know, fancy what XYZ, it depends on when people listen to this, what the newest fancy thing is. But you need to perfect the basics, which is diet, exercise, sleep. You need to have a sense of purpose and meaning. It's amazing how these blue zone things, places in the world that people live to be 100 more than anywhere else, they don't have access to fancy hospitals, fancy technology, and yet they live longer than people who have access to that. So perfect the basics.
Yeah.
And I feel like that, and if that's all you take away, you'll take away, and then we have a bunch of other cool things in there as well too. So
I look forward to reading it. Okay, well, tell our listeners, where can they find you, your book, and your practice?
the book is at uncurablebook.com, www.uncurablebook.com. If they want to learn more about me, they can just go to Aaron Hartman, MD. That's like the hub. They'll take you to the podcast, the book, my practice website. I have a personalized precision medicine practice now for people who want me to be their personal doctor. You can kind of find that through there as well. And then yeah, those are the main things. Aaron Hartman, MD, and uncurablebook.com.
Awesome. Well, I always conclude every episode asking your top longevity tip. And I did go back before we started recording today to see what you said on episode 74 years ago on the episode where we talked about SIRS. And you did talk about the basics there too. You mentioned fasting and exercise. So has your top longevity tip changed, or are you going to say something similar?
Well, I would make it three. It'd be fasting, exercise, and sleep.
And
I
sleep.
think
Okay.
since when I talked to you, then I've kind of personally realized I need to get my 8.5 hours a night. Super critical, and the literature is back that up, that sleep is a super food. It's a super nutrient. Without that, all the other stuff just doesn't work quite as well.
Yep. And now we have ways to track that, right? That we didn't. Oh, I'm
Yeah,
pointing to
and
my
I've
wrong
got
ring.
more
Other
ring
other
too.
hand has it where ring.
I've got more ring too.
Well, this was wonderful. Is there anything else you want to share with the audience before we wrap up?
I would just encourage people to get educated and learn about themselves, learn about health. I mean, it's such a crazy thing that today, with all the information out there, health is one of the most confused topics. Like, what diet, what food, what's right for me, and you really have to find out what works for you. And what worked for the last 20 people might not work for you. And that's why working with a practitioner, someone who's seen thousands of patients, has lots of experience, who knows how to take the data and apply it to you, that's really super important. So getting educated and finding someone you can work with, I think, are the two big takeaways.
Amen. I agree with that. Well, thank you so much for coming on the show again. I've appreciated just having you as a colleague that I can ask questions to on hard cases. Very intelligent, very experienced. You work with, again, just patients who are defying the odds. And one of those was your daughter. So what a beautiful story. Your patients and your family are blessed to have you. So thanks again for coming on the show.
Thanks a lot for having me. I really, really enjoyed it.